Ved. I am son of Mr. Jaysinh Ved, the patient admitted at Sterling Hospital, Vadodara. My father has been admitted since last week, wherein he developed critical lung infection, and it was an emergency where we had to leave and come to the emergency department in the night last week. And I would like to share the feedback based on the experiences what we had at various different interaction levels with the Sterling Hospital staff and infrastructure. First of all, for any hospital or the doctor is the heart of hospital or the face. If you have a very good experience with the doctor, you immediately also connect it with a good experience with the hospital, and of course all the other department experiences add into that experience. So first of all, I would like to thank, and we are fortunate that we are under the care of Dr. Neel Thakkar, who is the pulmonologist at Sterling Hospitals, as well as various other achievements what he has. નીલભાઈને ત્યાં અમારે આવીને અમને એટલું સારી સારવાર મળી છે, and because what we feel is that he has addressed the issue thoroughly and in a whole comprehensive manner, not only related to heart, like we have seen his nature, to the lungs, like we have seen his nature. He has investigated my father thoroughly, whether it is to the heart, but anything which is associated with it, even it may not be related to our lung issue, but then he has gone to great depths to explain us thoroughly what are the issues. He has roped in the relevant doctors and these other doctors, let's say from urology department or nephrology department or ENT department. They have been very prompt as a team to help us, to give us an answer and to address our issues as soon as possible. Right from the resident doctor, I think so he was Dr. Sagar when we came in in the night. He was very prompt to address our criticality, and we immediately got a very good response, and we were immediately diagnosed, and there were comprehensive scans which happened. Not even that, scans of heart, scans of lungs, or even the head. We were shown in a very detailed manner what is the issue, so that we can understand it better, because for a patient or a patient's relative, now it has become very critical to have an open and transparent diagnosis and situation where we stand and what are the further steps. Absolutely no issues, and we were so clear in what was happening, and we were immediately shifted to ICU. From ICU we came, and we were fortunate that my father is keeping well and with different treatments, and when there are certain issues of allergy, those have been addressed by having different medications. And right from day one, Dr. Neel has been the cornerstone, where he has explained us each and everything twice a day, what is happening, what are the reports, when they will come, and he has mobilized the whole infrastructure of Sterling for us in good faith for the hospital. And once we were shifted from ICU to our unit in the ward, in rooms, we have got good treatment, good service from various different staff. I would like to mention especially the sisters who helped us day in and day out. Of special mention is Arshna sister as well as Banu sister, who have been our caretakers for as when they change the shifts. These are dedicated ladies. Not only this, to all the ladies or whoever have attended us promptly. Only one feedback what I has is that perhaps we feel that there is little understaffing at the level of the ward, which if it is improved, it could be better in terms of little better timely care of different patients. Once there are more patients, and sometimes the infrastructure is under pressure, which is understood, but everything is taken care of and it is given a prompt treatment, but somewhere or the other it's a pressure on both the sides, which should ease, which should help the staff as well as the patient. That's the only feedback what we have, but absolutely no issues. I would like to mention about the admin staff, especially Mr. Neel and team. They have been very helpful, very caring to come and check with us if there are any issues, if there are anything what we could improve. So all in all, I would say that it has been a wonderful experience in terms of healing at Sterling. And also mentioned also about promptness of the security staff and the understanding what they have in terms of whatever we want to, in terms of visitor timings, in terms of cooperation with different relatives, or even with different issues related right from the parking to any small issues, anything which is related, security has been of Sierra has been excellent. So I would like to thank Sterling Hospital for giving us the kind attention, and I hope all the success for Sterling. Thank you.